Today on the show, I'm joined by Dr. Olivier Amar, one of the UK's leading consultant plastic reconstructive and aesthetic surgeons. During the episode, Olivier and I talk about his surgical practice and his contributions to groundbreaking non-surgical treatments, how he built a successful business and became known as the master of refinement, and how aesthetic procedures can help to improve a person's well-being. Olivier also talks about the challenges that can occur in a high-pressured career. I'm so excited to have you here, honestly, so excited. So for our listeners who aren't really quite familiar with your practice, can you tell us a bit about your practice and what you specialise in?
So I'm a plastic and reconstructive surgeon. I'm doing cosmetic treatment, surgical and non-surgical, around the face and the body for body contouring and facial enhancements, and try to make that as natural as possible.
Why did you choose to have a career in cosmetic surgery?
I'm not sure. Maybe the career chose me. I mean, I'm born in a family of doctors, and my father is a plastic surgeon. They never pushed me to become a surgeon, or they were saying, "Oh, there's a lot of work." But I think I just loved it. I see my parents working a lot, but working with human also is great. Be able to shape curves, sculpt faces. That's a great chance. So I'm very happy.
So you were just talking about shaping and sculpting. Is that how you earned your title of the Master of Refinement?
I'm not sure where that come from, but yes, I mean, maybe being a technician with an artistic eyes can help you. I think techniques is one thing. You need to master the technique before you become artistic. But I think if this, I probably have a bit of artistic eyes, definitely.
Do you think you need to be artistic to master the technique?
No. You need to be a very, very excellent technician, and you can leave a bit of your artistic vision on top. I think because surgery is serious, you need to deliver. You need to do that in a safe environment and in a safe way. So I think to be too artistic is probably not good, but be a very good technician with an artistic eyes, probably a good thing.
Do you think that you learned that from your father, growing up in that environment? Or is that something that you learned along your career?
I think both. I think definitely if your mother is a pianist, you might play piano well, you might develop some senses. So I think looking at my dad works, speaking a lot with them, it's probably stimulate me in this way. Yeah.
Talking to people.
Yes, definitely. I think the environment, and after when you start practicing on your own, you develop other senses. So it's a combination. Yeah, definitely.
Yeah. So when you are having an initial consultation with your patients, how do you ensure that you understand and subsequently handle your patients' expectations?
By listening to them first. So consultation lasts sometimes up to an hour, because I don't think you can just get through everything in 15 minutes consultation. So it's more understanding who they are, understanding also their medical background. And after there is a difficult time sometimes is looking at the mirror. So we look at the mirror together. And we try to see, sometimes it's cruel to look at the mirror, but we would like to see where we are, specifically when everyone is using filter now. And so we try to have an assessment of where we are. And from there, I try to see if I can reach their expectation, or sometimes I have to manage their expectation. And we, by the end of the full hour of consultation, we should go to a place where we have together come to a decision.
Yeah.
I would invite them anyway to come back for a second consultation after at least few days of up to 2 weeks of reflection, and we can rediscuss everything before we do surgery.
I like how you just said reaching their expectations and handling them, because for me it sounds like there would be a very fine line in that. Okay. It sounds to me like you would really need to be an expert and knowing when you're reaching them and when you're handling them.
You see, again, cosmetic surgery is surgery, so we have a responsibility to treat the patient under sedation, even if it's local. So this is like, for us, and for me, it's very important that I have understood what they want, and we have an agreement of what the surgery can deliver.
And you also mentioned about people bringing in photos with filters on. Do you see a lot of that?
Well, I mean, it's more when you ask patients sometimes, show me a photo of you when you like yourself, right? And sometimes they show you pictures where they have a tan, or they wear glasses if there's the faces, or it's not really with
true reflection of themselves.
No. I think maybe we all have a better version of ourselves, and we like to see in the mirror, and we say to ourselves, well, maybe because I didn't sleep enough, or because maybe I didn't exercise recently, we tried us, just to feel better. I think during the consultation we definitely look at reality and see what can be done.
It sounds like you're having a consultation about their body and mind, really.
Well, they're well connected, right? Yeah. So surgery can't give you happiness. It's not the pills, right? It's not. But when you do surgery, what I aim for is to try to support and help this self-confidence you may have lost due to the aging process, due to weight loss, due to gain loss.
I guess it could be a number of different things why people have surgery. So can you tell us a bit about your inventions that you have created? I know that you are the creator of Express PRP and a more recent treatment, how do you say it, Uronce?
I'm not a creator of the PRP, right? So the way I perform PRP, it might be slightly different than others. So the thing is, PRP, what it means is plate-rich plasma. Mm-hmm. That we are looking at some growth factor who help the cell division. So it's kind of like a booster for your cells, and we have that inside the plasma. Where is the plasma? Is inside the blood. So we have the red cells, the white cells, we have the plasma. So we draw in a little bit of blood from you, 5, 10, 20 cc, depend. We put it in the centrifuge, and we get, after a few minutes, different phases. You have something a bit yellowish called the plasma, and inside you have the platelet. And these platelets are rich of growth factor. So basically what we try to do is to get this platelet out of your blood and re-inject them to boost your skin, to support the healing as well. If you do energy devices treatment, lasered, radiofrequency, wherever you want to support the healing process, we try to bring some of this growth factor. So the PRP Express, as you mentioned, is a way of extracting a bit of the blood, spinning this blood, and re-injected with a specific cannula, so you don't have this 100 of puncture, and you don't look like a pincushion. And this 2, 3, 4 very tiny puncture where I use a very thin cannula just to nourish your skin from.
So how did you come to discover there was a need for this different kind of PRP?
It's derivative from what we do in surgery, really. So again, there's a different way of treating skin. There's a different approach. Sometimes I can use the needle. Just say that I don't, but sometimes I might use it depending if I'm treating like scars or not. But if it's only for cosmetic purposes to give you a boost, and it becomes very, very popular because it gives you the glow like a lot of patients are looking for. It's a great treatment. It's an in and out treatment. It's 20 minutes with us. Give you a glow for a few weeks. You can have like a course of 2 or 3. That's great, and it helps a lot. And it's natural because more and more patients are looking for a natural treatment. You have mentioned Uvance. I'm the chief medical officer of Uvance. So Uvance is not me, but I'm part of it. Uvance is a breakthrough in the industry, really. It's again bringing a surgery in a box. What does that mean? We have fantastic cells inside our fat. And I know that we all fight this fat with dieting, with exercise, but we have fantastic cells who have like an enormous regenerative potential. And some of these cells are what we call adipose-derived mesenchymal stem cells. So let's be simple. They have like stem cells capabilities, meaning like they can differentiate. In one word, they can help you to look better. So, and it can rejuvenate your skin like no other treatment can do. So it's like bringing live cells, bringing even some soldiers to the forefront of the battlefields against the aging process. And so it complements well the PRP, because PRP might be the bullet these fighters need, but you bring new cells. So Uvance is like, I think, a revolution in the industry, because you will have centers where a patient can go get some cells extracted, will be send it to a lab. The lab will prepare the tissue, will extract the cells, and will reload the syringes with a quality control and standardization. So it means like you will receive your own personal filler. See, I don't want to be too technical, but literally you go to a center during your lunch break, you have like a micro collection through a micro liposuction. So we need few cc, few ml, few milliliter of your fat, and you can go back to your normal activity. What happened is like in this kind of like specific box, this and a special courier, your cells will be sent to the lab. Some tests are going to be run to see if there is no germs or no contamination, and they'll be cryopreserved. And maybe when you need it in 2 months, 3 months, 6 months time, up to 5 years, you can have it. And when you have your injection, you can have by any doctors. So you like your dermatologist, you are your cosmetic doctors to do it, they will be able to receive it. So it's giving access to natural and regenerative medicine to everyone. So yeah,
So how does a plastic surgeon or cosmetic surgeon get involved in other projects like that? How does someone become a chief medical officer?
Like seeing the need, right? So I remember I discussed with the CEO of the event a few years ago, and he was at the time in the filler industry. And what's filler are more synthetic, right? Because the hyaluronic acid that you use on most filler is produced by a manufacturer, right? It's not something. It might look natural if you inject it well, but this is not really natural. Yeah, exactly. This isn't live cells. So he said to me, Reese Tomlinson said to me, how do you see the future? I said, well, I will dream that someday what we do in surgery can arrive in a box. So I don't have to do all this process, and it will be standardized and done in a laboratory with all the quality standards needed, and for me, I can do the injection on the day, few minutes. Patient can go back to their activity, have received their own cells, and if they want to have another injection in 6 months' time, we can have it. And he said to me, "Let's do it." And we work hard for like 6 years, and we find great people along the way, and we have a fantastic chairman, Chris Donegan, and we have to find investors. We have to find, I didn't know what the adventure will be. We just started by a dream, like just getting this cells in the box and be able to open a box like you open any type of box of a filler today and say, this is your cells that I'm injecting you. So that's how everything started.
It sounds like a real project to develop through time. How long does a project take like that to develop?
Everything you touch, like medicine and patient safety, and takes time. So it can't happen overnight. So in our case, as I said, it's almost 7 years that we started the project. So between the time you think about having this great idea and you can have an actual box delivered and do some real patient takes a while. In a medical kind of a frame time, look at before COVID, like for vaccine, it was like 5 to 10 years. So now everything has changed, but when you want to develop some medication, it takes more than 5 years. So this is roughly the time it takes.
That's really interesting. What advice would you give to somebody who is thinking about becoming a cosmetic surgeon?
Okay, before you become a cosmetic surgeon, it takes kind of a long study. Depending where you train, you probably have to do a lot of things who are not cosmetic to you. You have to do hand surgery, burns, breast reconstruction, sometimes orthopedics, sometimes visceral surgery, sometimes pediatrics, and none of them are cosmetic. So I think like maybe spending, visiting some surgeon and asking questions, maybe looking at their life. But after it's a fantastic job. I mean, you see a patient every day. You can work on a human body, and you don't feel like working because it's like your passion. It's fine.
So why is it that you have to go through those procedures that aren't so cosmetic?
Well, because cosmetics comes, before you think about doing a facelift, you need to know the anatomy. And when you do breast, surgeon perform breast reconstruction, and so cosmetic is like the latest things you do in the training of a plastic surgeon. Before that, you have to master most of the different specialties before you go to the cosmetic. It's probably why it's like safest to see a plastic surgeon for advice before you do a treatment.
So there's a difference between cosmetic and plastic surgery. Plastic can be reconstructive.
Technically, the specialties is plastic, reconstructive, and aesthetic surgery. So when you graduate in the UK or in Europe, you're a plastic, reconstructive, and aesthetic surgeon. There is no training just for cosmetic. You might find them in different places in the world, but otherwise you have a very high-skilled surgeon who decide to do part of their activity in the cosmetic field.
So anybody that is thinking about pursuing a career in cosmetic surgery, what do they tend to study at university, college? Obviously there's many different qualifications and degrees that you need to go through before you are at your final stage. So what's the first stage?
I think being a rounded person is also helpful because surgery is only one part of your activity. You definitely have a human and a psychological part, and the psychological part is it's a big part actually of the practice because when you face a patient who needs to have a reconstruction, you need to be able to find the right words to assess the situation. Same thing when you face cosmetic expectation, an understanding about human being and the psychology I think is important, and it will link to management of expectation. I think this psychological side of the practice it's very important. So I think everything like psychological and human being oriented will be welcome probably.
So is being a great surgeon enough to be successful, or how can talented surgeons ensure they become known in order to make a good living?
It's like in every job probably. It's a lot of work, definitely. Slowly, it may take 5-6 years. Normally for a plastic surgeon, when you start your activity, it takes at least 5 years for your name to come out there, and for your peers or just the GPs around you to say, oh, I think he's doing a good job. So it takes time, and after, it's work.
So you mentioned something about GPs. What relationship do surgeons have with GPs?
We technically keep GPs informed about what we are doing, what we are planning to do. I think they are very important because they know the patient also very well, and sometimes we need to protect patient from themselves. So we see patient in consultation, we write to GPs, that's part of the guidelines. And they might have to see also the GPs sometime post-surgery, so that's good for GPs to be informed. So GPs are essential because they are follow the patient all years around. So it's definitely a part of the practice to have a good relationship with the GPs.
As a surgeon, what is a challenge that you have been faced with, and how have you overcome it?
Challenge. Yeah. You have challenge every day. Doing surgery is a challenge, like every single day. I mean, running a private practice is like running a private business is also challenging. There is so many aspects. You're not just like a surgeon. You're a surgeon, you're a psychologist, you can sometimes, unfortunately, come down to a business that you need to make it run. Like there's sometimes employees that you need to look after. So I mean, life will bring you challenges every day, so you need to keep yourself updated on everything. You need to have time for yourself. You need to have time for your family. You need to have time for your patient. You need to make that work sleekly, nicely. So challenges.
I'm really impressed how you can run a business and run your practice. I mean, I guess your practice is your business, but it's having the mindset of surgeon and businessman, which I think are two really great responsibilities and demanding jobs in themselves. So I'm always really impressed when somebody like yourself pulls them both off in such an incredible manner.
Thank you. Again, when you have the chance to live a life passion, I mean, that's true that I work all the time. So I work like evenings, sometimes weekends, but I don't feel like too much working sometimes.
Because it's a passion.
Yeah, I mean, I have to say something. It's not like I'm tired also.
Yeah.
You face challenges, so it takes you a lot of energy for sure. The business I'm involved with is very close to my everyday practice. So what I'm transferring is knowledge, and what I'm learning from one side, I can benefit the other side. So more I do research with labs and research, more I nurture my practice. So it's a lot of it's
transferable skills.
Exactly.
Yeah.
So it's not something. I probably will not be able to do something too different, and I'll be probably not qualified.
Yeah, but they overlap, so transferable skills. Yeah,
transferable, overlap, and having great
team.
Yeah, that's the key. I mean, like, if you want to succeed, you need a great team, and working with a team is essential. So
how has COVID-19 affected your business?
Cosmetic surgery, if we speak about cosmetic surgery, has been stopped for almost 4 months. So we were not able to face patients, to do any treatment. They were not able to come to the practice. So it's been very challenging. Now we have worked hard to put together a measure in place to resume the activity. It goes from this like plexiglass screen that exists between us today, between testing, screening patient. It's a very, very long list, and there is guidance of the NHS England you can follow. So it slowed down the practice because there's a lot of measure and distanciation and precaution we need to take. And the same thing for surgery. We can't do surgery on everyone. We have to respect some BMI, some age group, eventually some comorbidity, some treatment for heart conditions. So we definitely have changed the practice.
Do you think that people working from home has caused a spike in cosmetic surgery? Because of course people aren't needing to book the time off for downtime.
I think like maybe what happened during this period is health came back to the center of life for most of us. So yes, you from home, maybe they stop smoking sometimes, start to do a bit of exercise, try to get a better sleep, maybe less stress from work, start thinking about doing things for themselves. So yeah, for sure, you have still the pressure from the Zoom call and facing yourself. But looking at the body, surgery, maybe recovering from home is helping. So I have to say, we see more patients maybe saying, okay, I work from home, I can recover from home. So, and just because they want to treat themselves also maybe.
Yeah.
I think like this period is creating a lot of anxiety around the future and thinking about themselves, having a better lifestyle. It's part of some new trends.
People being at home hasn't stopped them from wanting to look better just because they're not going out.
The society didn't stop, right? So if you look at social media or everything online, I think society is just continue and people wants to look good, and at least they think about when everything will be finished, because one day, I don't know when, it might be around this virus for a little while, but they dream about, like all of us, coming back to normality, where we can gather with friends, having dinners, going to restaurants, see movies.
Just interacting with people.
Exactly.
The way we were. People want to feel good, and that comes with looking good, I think. So do you think the aesthetic procedures that your patients choose to have affect their well-being?
When you help to improve a silhouette or a neck or jawline definition, suddenly a patient described that they feel more confident. So being more confident helps them to feel better in their private life, sometimes better with their business life. And I think this is linked to well-being. So they just feel better. And I think if surgery can help you to feel better, that's making my day.
Yeah. As a cosmetic surgeon, would you say you have a high-pressure job? How do you handle the pressure?
Well, I think every surgeon has a high-pressure job. We have it's not life-threatening situation, but we put patient under sedation or local. We are, most of the time, we are cutting patient. We are dealing with vessels. So yeah, there's definitely but again, with the training is like a pilot, right? I think everything in life with training, you reduce the stress, you reduce the pressure, because more you are trained, more you are updated, more you do the type of procedures that you are doing. This makes you feeling more confident and comfortable with what you do. So I think surgery is still like a risk management kind of work, but again, training work, getting the right assessment of patient, putting the right indication, managing the expectation, making sure that your practice is organized. I think it's all about organization and work again.
Having confidence in yourself, but having that confidence in yourself because you know that you're running your business to the best possible standard that anybody can.
Well, without putting too much pressure on yourself, but I think it's like everywhere. Right? If you are organized and if you try to raise the bar all the time and be professional, that should reduce the pressure.
Yeah, that makes complete sense. So, do you think that you have a healthy work-life balance?
I do the best I can.
Yeah.
I probably would love to do more sports, but with COVID it's a bit complicated, but maybe it's an excuse. Yeah, it's finding the right balance between having enough sleep when you have big days, try to be healthy as possible, and try to find a personal balance, a family life. I think the whole thing make you stronger to face challenges.
Yeah, I think when you have family and friends around you, working so hard isn't too bad. As we were talking about before, if you're passionate about your job and you have family around you and friends that support you, it kind of keeps you going and keeps you motivated.
Yeah, and you need to still definitely thank your family for their support and be there for them, because when you're passionate, as you work hard, long hours, so you might not see them as much. Try to make sure between the week and a weekend that the balance still right.
So you mentioned that you like to play sports and like to have family time. What other self-care activities do you like to do? If you were to have your day off and do nothing but to, just enjoy yourself, what would that be?
Oh, it can be so many things. I think it's a mix of having time for you to reflect is important. Kind of like a gentle meditation. I think it's helping. Try to recenter yourself, attach your value to your education, maybe. So I think not losing yourself when you work hard is important. Making sure that you have the right mind and you know what is important. So family value, friends, work, making sure you can separate the thing and work. So if I have a day off, probably a bit of sports, a bit of meditation, a bit of time off, just on my own, and I'll probably, if COVID allowed, meeting friends, having a nice dinner.
You mentioned meditation a couple of times. Do you find it quite difficult to switch off, being so active all the time and speaking to people? Because of course a big part of your job is speaking to people and dealing with staff and just being on the go all the time, or you just very
I think I try to have few minutes or 15 every day, 15-20 minutes on my own, just to try to try again to make peace with myself.
Yeah.
And to recenter myself.
So you've made it into a habit. Really.
Yeah, it's just trying like kind of transition cool off period. You need like the transition from home to work and work from home. If you can have a bit of time for yourself, it's important.
Yeah, of course.
Silence.
Working all the time isn't sustainable.
No.
Absolutely not. Well, I'm going to let you go because it's the end of the day and Mr Amar has been working all day, so I'm not going to keep him to myself any longer. You've been an incredible guest.
Thank you.